Assalamualaikum and hi to Dr. Hakam and my fellow friends. First thing first, I would like to introduce my group members and I. Firstly, Nur Shaliza binti Anwar, H22A0244. The second one is Nur Zaini Shahila binti Mahadi, H22A0172. The third one is Nurul Izzati binti Bakhtiar, H22A0874. The next one is Ramdan Rahman Dirachman, H22A0382. Next, Nur Afifah binti Amri, H22A0385. The next one is Nur Aina Shamira binti Zuti, H22A0619. Nur Shazlin binti Muhammad Rahim, H22A0759. And the last one is me, Nur Afika Nadira binti Muhammad Hairul, H22A0769.
Diabetes is a chronic metabolic disorder characterized by high blood sugar level over time. It occurs when the body either does not produce enough insulin or cannot effectively utilize the insulin it produces. Insulin is a hormone produced by the pancreas that help regulate blood sugar level and allow glucose to enter cell for energy production. There are three main types of diabetes. Type 1 diabetes. This type usually develop in childhood or adolescence, although it can occur at any age. It is an autoimmune condition in which the body immune system mistakenly attack and destroy the insulin producing cell in the pancreas. Secondly, type 2 diabetes. This type is the most common form of diabetes, accounting for the majority of cases. It usually occurs in adulthood, although it is increasingly being diagnosed in children and adolescents due to rising obesity rate. Type 2 diabetes develop when the body becomes resistant to the effect of insulin or when the pancreas fails to produce enough insulin. Next, gestational diabetes. This type occurs during pregnancy and usually resolves after childbirth. It affects pregnant women with high blood sugar level not present before pregnancy. Gestational diabetes can increase the risk of complication during pregnancy and delivery. It also put the mother at a high risk of developing type 2 diabetes later in life. Common symptoms of diabetes include increased thirst, frequent urination, inexplained weight loss, extreme hunger, fatigue, blurred vision, slow healing of wound, and recurrent infection. However, some individuals with type 2 diabetes may not experience noticeable system inactivity. Long-term complications of diabetes can affect various organs and systems in the body. These complications include heart disease, stroke, kidney disease, and systems in the body. Managing diabetes involves maintaining healthy blood sugar level through a combination of medication, regular physical activity, and balanced diet, and monitoring blood sugar level. Individuals with diabetes need to work closely with healthcare professionals to develop an individualized treatment plan and to regularly monitor and control their blood sugar level to prevent complications and lead a healthy life.
Diabetes or diabetes mellitus is a type of disease that can characterized by hyperglycemia, high blood glucose content, especially after food intake. On severe diabetes occurs when the pancreas gland is constantly use insulin and sometimes exceed normal levels. On time, somebody cannot use this insulin, making the patient in a state of insufficient insulin. Insulin is a type of hormone that controls blood sugar levels. When we eat or drink, the sugar content in food or the drink stimulate the pancreas gland to produce insulin. Insulin allows sugar to broken down into simple forms in the blood, move to the cell to enable the cell to function. However, if the transfer process does not occur as a result lack of insulin, the blood will have excess sugar, so with that will happen diabetes. Diabetes can be classified as type 1 diabetes is also known as diabetes insulin dependent, insulin dependent diabetes mellitus, or juvenile onset diabetes. Type 1 diabetes is characterized by failure of insulin production by the pancreas. Usually, people with type 1 diabetes begin to get symptoms of the disease during childhood or adolescence. Due to failure natural insulin production by the body, the patient needs insulin injection from outside to regulate blood glucose levels. Type 2 diabetes can be caused by resistance insulin, decreased sensitivity of body tissue to insulin, and or decreased insulin production. Diabetes type 2 because still have some insulin from the pancreas. Control by monitoring food intake, reduction body weight, exercise, and medication intake by feed. Insulin injection are required in certain circumstances if taking medicine by food is less effective or giving serious side effect to the patient.
How does the disease happen? Diabetes mellitus is a chronic condition caused by high blood sugar level in the body. This disease occurs due to the disturbance in the production or use of the hormone insulin, which regulate the metabolism of sugar in the body. The following are the mechanism of the development of diabetes. Glucose metabolism. When food containing carbohydrate is consumed, the body breaks down carbohydrate into a primary sugar called glucose. 2. Insulin secretion. The pancreas and organ located behind the stomach produces the hormone insulin. 3. Insulin resistance. In type 2 diabetes, the body increases resistance to insulin. Insufficiency insulin production. In type 1 diabetes, the pancreas cannot produce enough insulin. Hyperglycemia, high level of glucose in the blood, called hyperglycemia, is a hallmark of diabetes. Last, system of diabetes include frequent urination, excessive. This explains weight loss, fatigue, decreased muscle strength, frequent and difficult to heal infection, and vision problem. The development of diabetes involves disturbance in glucose metabolism and influences that differ according to the type of diabetes. Diabetes management involves controlling blood glucose level through health lifestyle change, medication use, and insulin use. Consult a medical professional for more information about diabetes diagnosis and treatment.
Diabetes disease is often happen in older people or overweight individuals such as obesity. In general, diabetes can occur in children, adolescent, adulthood, pregnant women, and the elderly. Indirectly, I was able to research that this disease often shows an increase in children as well as adulthood. Diabetes type 1 occur when a children and adolescent has an injury to the pancreas occurs due to infection, tumor, injury, accident, or side effects after a major operation. Diabetes type 2 occur when adult and the elderly rarely exercise or physical activity, overweight or obesity, suffering from prediabetes, suffering from high cholesterol, and suffering from high blood pressure, such as hypertension. Diabetes disease is not only suffered by those aged 60 years old and above, it is also experienced by children as young as 6 to 7 years old and pregnant women or aged under 30. For example, type 1 diabetes often occur in children and adolescents. The prevalence is rare, which is 5% of patients with diabetes, 0.03 per 100,000 population are Malaysian children. Diabetes that occur in pregnant women is gestational diabetic. Gestational diabetes is a pregnant woman who needs insulin for her baby's needs. If the body is unable to produce additional insulin for the needs of the unborn child, then the mother will experience high blood sugar levels. Meanwhile, type 2 diabetes is more common after the age of 40, but the number of younger patients nowadays is increasing. But type 2 diabetes also usually occurs in adulthood for the overweight, who thus have a parent or sibling with the condition, aren't physically active, have had gestational diabetes, have prediabetes, have high blood pressure, high cholesterol, and high triglyceride. Last year, 17.6% of people aged 40 and under had diabetes. Type 2 diabetes is the body cannot use insulin properly.
For the next slide, I want to talk about how to prevent diabetes. Diabetes is characterized by high blood sugar levels. Disease can be related or factor for diabetes. We need to prevent this disease in many ways for have a healthy life. For the first step is doing pre-diabetes diet. This can help us to maintain ideal body weight so that the risk of diabetes will decrease, such as follow the food pyramid every day. For the second step is doing sport activities or exercise. It is because if doing exercise that lower blood sugar than routine can be a powerful ways for prevent diabetes, such as playing badminton, jogging, and so on. Last step you can doing to prevent diabetes is drink plain water. It is because the ability of body cells to respond insulin well. We can start consuming water with carrying water bottle everywhere we go, such as our bedroom or office. We also encourage to drink 8 glasses of water a day.
In conclusion, diabetes affects the body's capacity to metabolize blood glucose, commonly known as blood sugar, and is a long-term health issue. It occurs either because our body does not create enough insulin or because it cannot effectively utilize the insulin that is produced. Other than that, uncontrolled diabetes steadily harms the body's critical organs, which leads to their malfunctions and serious health issues. Thus, to maintain the health of their hearts and other essential organs, people with diabetes should take the necessary precautions. After that, as diabetes poses a major risk for life, it needs to be carefully monitored and efficiently controlled with the right medication and lifestyle changes. We can live a healthy and long life by leading a healthy lifestyle, getting frequent checkups, and using the right medications. Next, studies have shown that as people age, their risk of contracting a disease increases, not to mention if other aspects of their health, particularly their diet, are neglected. Finally, diabetes is a chronic illness with a significant risk. However, if each person prioritizes their own health and always manage their food, this condition can be prevented. That's all from us. Thank you.